Belatacept Solution, Reconstituted, Recon Soln, is a medication used to prevent organ rejection in people who have had a kidney transplant. It is taken with other medications, like mycophenolate and corticosteroids, to help the new organ work properly. Belatacept belongs to a group of drugs called immunosuppressants, which helps weaken the body's natural defense, immune system, to avoid rejection of the new kidney. It is important to take belatacept as directed by your doctor, usually every 2 weeks, and at the same time each day. This medication can be taken with or without food. Before starting belatacept, make sure to read the medication guide provided by your pharmacist. Your doctor may also direct you to enroll in a special program from the manufacturer before using this medication. This medication is given by injection into a vein as directed by your doctor, usually over 30 minutes. After the first dose, this medication is given on a regular schedule as directed by your doctor, and the dosage is based on your weight. Do not increase your dose or use this drug more often or for longer than prescribed. If you are giving this medication to yourself at home, learn all preparation and usage instructions from your healthcare professional. This medication can increase your risk for serious infections, so your doctor may direct you to take other medications along with belatacept to help prevent these serious infections. Make sure to mark your calendar to keep track of when to receive the next dose. Side effects of Belatacept Solution, Reconstituted, Recon Soln, may include headache, nausea, or diarrhea. If any of these effects persist or worsen, inform your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed to you because the benefit to you is greater than the risk of side effects for most people. However, it's important to be aware of potential serious side effects, such as signs of kidney problems and symptoms of infection like cough, sore throat, fever, or chills. Belatacept may also increase the risk of rare and possibly fatal brain infections and certain types of cancer, so be sure to notify your doctor right away if you notice any symptoms of concern. While a serious allergic reaction is rare, seek medical help immediately if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing. Remember, this is not a complete list of possible side effects, so always consult your doctor or pharmacist if you notice any other effects. Belatacept Solution, Reconstituted, Recon Soln, is a medication that is used to help prevent organ rejection after receiving a kidney transplant. However, it is important to be aware that there are some potential risks associated with taking this medication. It may increase the risk for developing serious infections or certain cancers, including a condition called post-transplant lymphoproliferative disorder, PTLD, which can become a type of cancer. This risk is higher in people who have not previously been exposed to a certain virus called Epstein-Barr virus. Before starting treatment with belatacept, your doctor should test you to check if you have had previous exposure to Epstein-Barr virus. It's also important to note that belatacept is not recommended for use to help prevent organ rejection after a liver transplant. If you are prescribed belatacept, it's crucial to follow your doctor's instructions carefully and to discuss any concerns or questions you may have about the medication. Always take belatacept exactly as prescribed by your doctor and at the recommended dosage and frequency. Before using belatacept, it's important to talk to your doctor or pharmacist about any allergies you may have, as well as any inactive ingredients that could cause allergic reactions. Additionally, discuss your medical history, especially if you have had recent infections, cancer, or immune system disorders. Belatacept may increase your risk of getting infections or make current infections worse, so it's important to avoid contact with anyone who has a contagious illness. Inform your healthcare professional before getting any vaccinations or immunizations, and stay away from people who have recently received live vaccines. Since this medication can increase your risk of developing skin cancer, it's important to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. Before undergoing any surgery, make sure to inform your doctor or dentist about all the medications and products you are using. If you are pregnant or planning to become pregnant, discuss the risks and benefits of using belatacept with your doctor. It is also important to consult your doctor before breastfeeding while using this medication. When taking belatacept solution, it's important to be aware of potential drug interactions that may affect how it works or increase your risk for serious side effects. It's crucial to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Belatacept solution include other drugs that weaken the immune system or increase the risk of infection, such as natalizumab and rituximab. Be sure to discuss any concerns with your healthcare provider for personalized advice. If someone has taken too much Belatacept solution and is experiencing severe symptoms such as fainting or difficulty breathing, it's important to seek immediate medical assistance. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. In Canada, residents can call their provincial poison control center. It is important to undergo lab and/or medical tests, such as kidney function and complete blood count, while using Belatacept solution, Reconstituted. Make sure to attend all medical and lab appointments and consult your doctor for more details. As for the optimal timing, Belatacept solution, Reconstituted is usually administered by a healthcare professional in a medical setting. The dosage is based on your medical condition, weight, and response to treatment. It is typically given as a single dose before a kidney transplant, and then as a maintenance dose every 4 weeks thereafter. Be sure to follow your doctor's instructions carefully for the best results. Be sure to take Belatacept solution, Reconstituted, Recon Soln, as directed by your healthcare provider. If you happen to miss a dose, consult with your doctor or pharmacist to create a new dosing schedule. It's important not to take a double dose to make up for a missed one. Be sure to consult the product instructions and your pharmacist for storage details. It's important to keep all medications away from children and pets, so be sure to store this medication in a safe place. When it comes to discarding this product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard this product when it is expired or no longer needed. If you have any questions about how to dispose of this medication, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.